type 2 diabetes metabolic disorder. Imagine your body as a car and insulin as the key that starts the engine. In type 2 diabetes, this key doesn't work properly anymore. Your body either doesn't make enough insulin or has become resistant to it, like a worn-out lock that won't turn. Every time you eat, your food gets broken down into sugar glucose, which should power your cells. But without working insulin, this sugar gets stuck in your bloodstream, like traffic jamming up on a highway. Over time, this sugar traffic jam can damage your blood vessels, nerves, and organs. What makes type 2 diabetes fascinating is that it's largely influenced by lifestyle, unlike its cousin type 1 diabetes. Think of it as a slow-burning fire that builds up over years of certain lifestyle choices. Your body gradually loses its ability to process sugar effectively, like a machine wearing down from overuse. The real danger lies in its sneaky nature. Many people don't realize they have it until significant damage is done. It's like a silent flood slowly rising in your basement. By the time you notice, there's already considerable damage to deal with. Hypertension, high blood pressure. Think of your blood vessels as a network of garden hoses. Hypertension is like turning up the water pressure too high, putting strain on every inch of the system. This invisible force silently damages your blood vessels, heart, and organs over time. The fascinating thing about blood pressure is its dual nature: systolic when your heart beats and diastolic when your heart rests. It's like a rhythm of push and relax, happening about 100,000 times a day. When this pressure stays too high, it's like constantly overinflating a balloon. Eventually, something has to give. Modern lifestyle plays a huge role in this condition. Our bodies evolved to handle occasional stress, like running from predators, but not the constant pressure of modern life. It's like an engine designed for occasional sprints being forced to run at high speed continuously. The scariest part: high blood pressure usually has no symptoms until serious damage occurs. It's earned the nickname silent killer because many people don't realize they have it until it's caused significant harm to their cardiovascular system.
Click subscribe to this channel to get more topics you love.
Multiple sclerosis, MS. Imagine your nervous system as an incredibly complex electrical grid, with wires, nerves protected by insulation myelin. In MS, your immune system mistakenly attacks this insulation, like vandals stripping copper wire from power lines, causing short circuits throughout your body. The unpredictable nature of MS makes it particularly challenging. Symptoms can appear and disappear randomly, like lights flickering in different parts of a house with faulty wiring. One day you might have trouble walking, another day your vision might blur, and then you might feel fine for weeks or months. What's particularly fascinating is how MS affects different people in completely different ways. It's like each person has their own unique version of the disease. This is why MS is often called the disease of 1,000 faces. No two people experience it exactly the same way. The battle against MS happens primarily in the brain and spinal cord, where the immune system launches these misguided attacks. It's like having overzealous security guards who can't tell the difference between threats and essential workers, so they end up attacking both. Fibromyalgia. Picture your nervous system as a sound mixing board. In fibromyalgia, someone has turned up all the pain dials to maximum volume. Normal sensations that should be background noise become overwhelming symphonies of discomfort. The most intriguing aspect is how fibromyalgia amplifies pain throughout the body. It's like having your pain sensitivity dial stuck on high. Even gentle pressure can feel like intense pain. Your body becomes like an overtuned instrument, responding dramatically to the lightest touch. This condition affects sleep, memory, and mood, creating a complex web of symptoms. It's like trying to run a sophisticated computer system with corrupted software. Everything works, but not quite right. Simple tasks become exhausting, and rest doesn't seem to help restore energy levels. The invisible nature of fibromyalgia makes it particularly challenging socially. Since there are no visible signs of illness, many people struggle to understand or believe in the condition. It's like trying to explain a thunderstorm to someone who can neither see lightning nor hear thunder. Rheumatoid arthritis, RA. Imagine your immune system as an army protecting your body. In RA, this army gets confused and attacks your own joint tissue, like friendly fire in a battlefield. This friendly fire causes inflammation, pain, and eventually damages the joints. What makes RA fascinating is its symmetrical nature. It usually affects the same joints on both sides of the body. It's like a mirror image of destruction, with both hands, both knees, or both ankles being affected simultaneously. This symmetry is one of the key features that distinguishes it from other types of arthritis. But the condition goes beyond just joint pain. It's a systemic disease that can affect your entire body, including your heart, lungs, and blood vessels. Think of it as a wildfire that starts in your joints but can spread to other areas if not controlled. The morning stiffness characteristic of RA is particularly interesting. It's like your joints are rusty hinges that need extensive warming up before they can move properly. This stiffness typically lasts longer than an hour, unlike the brief morning stiffness that many people experience. Chronic fatigue syndrome, CFS. Imagine your body's energy production system as a rechargeable battery, but in CFS, the battery can't hold a charge properly. No matter how much you rest or sleep, you never feel fully recharged. It's like trying to run a smartphone with a damaged battery that never gets past 20% charge. The most distinctive feature is post-exertional malaise (PEM), a severe worsening of symptoms after any physical or mental activity. It's like having a limited energy budget, and if you overspend even slightly, you go into serious energy debt that takes days or weeks to recover from. This condition affects multiple body systems simultaneously. It's like having your body's master control system malfunctioning, affecting everything from energy production to sleep regulation, cognitive function, and physical stamina. Even simple tasks like showering or preparing a meal can exhaust a person's energy reserves. The cognitive symptoms, often called brain fog, are particularly debilitating. It's like trying to think through thick cotton wool or trying to run complex software on a computer with insufficient RAM. Simple mental tasks become challenging, and concentration becomes extremely difficult. Parkinson's disease. Imagine your brain as a vast chemical factory, with dopamine as one of its most important products. Parkinson's occurs when the cells producing this crucial chemical start dying off, like workers mysteriously disappearing from their posts. This shortage of dopamine creates a cascade of movement problems throughout the body. The fascinating aspect of Parkinson's is how it affects both motor and non-motor functions. The visible symptoms, tremors, rigid muscles, and slow movement, are like a dancer losing control of their choreography. But beneath these signs lies a complex web of invisible symptoms, changes in mood, sleep patterns, and even the ability to smell. What many people don't realize is that Parkinson's affects each person differently. It's like a painter working with the same colors, but creating entirely different paintings for each individual. Some might struggle with balance, while others battle more with stiffness or tremors. The disease particularly impacts automatic movements we take for granted. Simple tasks like blinking, swinging arms while walking, or facial expressions become challenging. It's as if the body's autopilot system is gradually shutting down. Most intriguingly, Parkinson's often starts affecting the body years before obvious symptoms appear. Scientists estimate that by the time tremors become noticeable, about 80% of dopamine-producing cells are already lost. The condition affects the entire family unit, not just the patient. As symptoms progress, roles within families often shift, creating a complex dynamic of care and adaptation. Osteoporosis. Think of your bones as a living, breathing bank account of minerals. Throughout your life, your body makes deposits and withdrawals of calcium and other minerals. Osteoporosis occurs when withdrawals consistently exceed deposits, leaving your bones porous and fragile. What makes osteoporosis particularly insidious is its silent progression. You can't feel your bones becoming weaker, there's no pain, no visible changes. It's like termites quietly weakening a house's structure. You might not notice until something breaks. The condition dramatically affects bone architecture at a microscopic level. Healthy bone has an internal structure like a honeycomb, but in osteoporosis, the holes in this honeycomb become larger and more numerous. Risk factors for osteoporosis tell an interesting story about human evolution. Women are particularly vulnerable after menopause when estrogen levels drop. This hormone plays a crucial role in bone maintenance, acting like a foreman overseeing construction. Modern lifestyle factors significantly impact bone health. Our increasingly sedentary lives mean bones aren't getting the stress signals they need to maintain strength. Prevention starts decades before the condition typically develops. Building strong bones in youth and early adulthood is like making deposits in a calcium bank for later in life. Systemic lupus erythematosus (SCLEROSIS). Lupus is like having your body's immune system turn into an overzealous security force that can't distinguish between friend and foe. This confusion leads to attacks on healthy tissues, creating a complex pattern of inflammation and damage that can affect virtually any organ system. The butterfly-shaped rash across the face, a classic lupus symptom, tells a deeper story. Like a butterfly's unpredictable flight, lupus symptoms can flutter from one body system to another, making it notoriously difficult to diagnose. One of the most fascinating aspects of lupus is its strong connection to sunlight sensitivity. For many patients, UV exposure can trigger flares, as if their immune system interprets sunlight as an invading enemy. The disease disproportionately affects women of childbearing age, suggesting a strong hormonal component. It's like having an immune system highly sensitive to hormonal fluctuations. Lupus is often called the great imitator because its symptoms can mimic many other conditions. This chameleon-like nature makes it challenging for both patients and healthcare providers. The fatigue associated with lupus is profound. It's like trying to run a marathon while wearing a lead suit. This, combined with the unpredictable flares, forces patients to become experts at energy management. Inflammatory bowel disease (IBD). Imagine your digestive system as a complex underground river system. In IBD, this river system becomes inflamed and turbulent, with Crohn's disease and ulcerative colitis being the two main forms. It's like having a series of storms constantly disrupting the normal flow and damaging the riverbanks. The immune system in IBD behaves like an over-enthusiastic cleaning crew, scrubbing so hard it damages the very surfaces it's meant to protect. In Crohn's, this damage can occur anywhere from mouth to anus, appearing in patches like scattered brush fires. Ulcerative colitis, meanwhile, creates continuous inflammation in the colon, like a steady flame burning from bottom to top. What makes IBD particularly challenging is its impact on nutrient absorption. When your digestive system is inflamed, it's like trying to water a garden with a leaky hose. Nutrients aren't properly absorbed, leading to deficiencies. This creates a frustrating cycle where the body needs more nutrients but has trouble obtaining them from food. The psychological impact of IBD is profound. Imagine planning your entire life around knowing the location of every bathroom, or having your social life disrupted by unpredictable flares. It's like living with an unreliable roommate who can cause chaos at any moment. This uncertainty often leads to anxiety and social isolation. The disease also demonstrates fascinating connections between stress, diet, and immune function. Each patient has unique triggers, like a personal code that needs to be cracked. What causes a flare in one person might have no effect on another, making it a highly individualized condition to manage. Most intriguingly, IBD rates are rising globally, particularly in newly industrialized countries. This suggests environmental factors play a crucial role, possibly related to changes in diet, lifestyle, and even our microbiome, the trillions of bacteria living in our gut. Celiac disease. Think of celiac disease as a case of mistaken identity in your gut. When a person with celiac eats gluten, a protein found in wheat, rye, and barley, their immune system reacts like a SWAT team responding to a false alarm, attacking the small intestine's lining in the process. The most fascinating aspect is how this single protein can cause such widespread damage. When gluten enters the digestive system of someone with celiac, it triggers an immune response that flattens the tiny finger-like projections villi in the small intestine. It's like turning a lush forest of nutrient-absorbing trees into a barren wasteland. What makes celiac disease particularly tricky is its chameleon-like nature. It can manifest in over 200 different symptoms, or sometimes no symptoms at all. It's like having a computer virus that can affect any program randomly, from your digestive system to your skin, bones, or even your brain. The genetic component of celiac disease tells an interesting evolutionary story. The condition is more common in populations with a long history of grain cultivation, suggesting it might be linked to the agricultural revolution. It's like our genes still haven't fully adapted to the dietary changes that began thousands of years ago. Modern food processing has inadvertently made celiac disease more challenging to manage. Gluten is now used in countless products, from obvious sources like bread to surprising ones like medications and lip balm. It's like having to navigate a minefield where danger can lurk in the most unexpected places. The good news is that celiac disease is one of the few autoimmune conditions with a known trigger, gluten, and a clear treatment, strict gluten avoidance. However, this simple solution requires constant vigilance and can significantly impact social and cultural aspects of eating. Ehlers-Danlos syndrome (AIDS). Imagine your body's connective tissue as the fabric holding everything together: your organs, blood vessels, skin, and joints. In ADs, this fabric is faulty, like a stretchy sweater that's lost its elasticity. This genetic condition affects collagen, the protein that gives tissues their strength and structure. The hypermobility aspect of ADs can be deceptively appealing at first. People with ADs might be extraordinarily flexible, able to perform contortionist-like movements effortlessly. However, this same flexibility makes joints unstable, like having door hinges that are too loose, leading to frequent dislocations and chronic pain. What many don't realize is that ADs affects far more than just joints and skin. Since connective tissue is everywhere in the body, problems can arise in any organ system. It's like having a building with structural problems. Issues can appear anywhere from the foundation to the roof. The condition often comes with a collection of seemingly unrelated symptoms that actually tell a connected story about how our bodies rely on healthy connective tissue. Problems can include digestive issues, cardiovascular concerns, and even dental problems. It's like having a domino effect, where one structural weakness leads to multiple downstream effects. Perhaps most challenging is the invisible nature of many AD symptoms. While some people might show obvious signs like extremely flexible joints or stretchy skin, others might look completely normal while dealing with severe internal complications. This has led to many ADS patients being misunderstood or having their symptoms dismissed. The impact on daily life is profound but often misunderstood. Simple activities like writing, opening jars, or even sitting in a chair can cause joint dislocations or pain. It requires constant body awareness, like having to consciously think about every movement that most people do automatically.